Youth is wasted on the young. As we age, we realize that this is nature's greatest trick. What causes our energy to deplete and make us look and feel older? It's diminished hormone production. For women, estrogen. For men, it's testosterone.
Hormone production actually starts decreasing around the age of 30, but we usually don't start noticing significant effects for 10 to 15 years later, when our hormones start to decrease as we age. The ability for the muscle system to be able to produce energy is markedly compromised. And as we age and lose that muscle physiology, we're no longer capable of making the energy, recovering from fatigue, and recovering from exercise. We lose that capability almost by 50% by the time we hit middle age. And that affects our ability to have the normal appearance that we once did. We find fat being deposited, we find our skin wrinkling because there's not enough blood supply, and it starts sagging because of lack of muscle tension. Without a continuous flow of hormone, then you're unable to produce serotonin in your brain, and when that happens, anxiety, irritability, sadness, depression, and lack of being able to manage stress adequately become almost everyday occurrences.
Lack of energy isn't the only drawback of decreased hormone production. Low hormone levels are related to a number of serious health risks, including osteoporosis, cancer, and heart disease.
As we age, we start losing our ability to produce our hormones, and our hormones help us, when they're there continuously in the proper amounts, to help us control our cholesterol, reduce the chances of cardiovascular disease, enhance the musculoskeletal system so that the muscle mass stays normal and bone mass stays normal. As we age then and our hormone production goes down, we start suffering cardiovascular disease such as high blood pressure, high cholesterol, the preponderance of increased chance of heart attack and stroke, as well as the musculoskeletal diseases such as arthritis, osteopenia, and osteoporosis.
Many doctors believe that by replacing these vital hormones, the aging process can be decelerated. Unlike synthetic replacement hormones of the past, today's are bioidentical, meaning they are exact chemical matches to hormones the body produces naturally. Both men and women have reported the following benefits from bioidentical hormone replacement therapy: enhanced libido, decreased body fat, increased energy, improved memory, relief from anxiety and depression.
The benefits that I've received from hormone replacement therapy are basically it's the energy level. My energy level has been far more than I had before I had them. Plus, I wasn't depressed, like clinically depressed, but I just didn't feel like doing anything. I didn't feel like I didn't have any passion for anything, and now I have, for my job, for my husband, for just for life.
One of the interesting and very great things that we've noticed is the cholesterol and the triglyceride levels have just become so much better based on an exercise regimen that I have in conjunction with doing the hormone therapy. I've never been able to have that impact before, no matter how hard I worked out. And I've seen that benefit now through looking at the results that I get when I go over the numbers with the doctors here. It's very wonderful. It's been awesome. This is the best shape I've been in 20 years, and I'm elated. My wife is my greatest supporter, but also my best critic, and she notices some wonderful things in terms of my health and obviously my shape.
While synthetic hormones have been linked to elevated health risks, bioidentical hormones have not been shown to pose the same problems. If you think you may benefit from bioidentical hormone replacement therapy, talk to your doctor.
Whenever I'm asked about bioidentical hormone replacement, I always recommend that they look for someone who evaluates them properly, knows exactly how to interpret the lab work, and knows to what that they are going to be individualizing the dose for that particular patient.
SottoPelle is cutting-edge hormone replacement therapy. Based on your unique hormonal needs, SottoPelle delivers a steady, low dose of natural hormones that brings the body back into balance as you age. SottoPelle is redefining aging for men and women.
By utilizing this form of therapy, it actually recreates the physiologic environment that a person used to be able to enjoy when they were much younger, say in their early 40s. And when you have the capability when you're 60 or 70 years old to enjoy the physiology that you once had, it really helps engender a much stronger quality of life and a much better lifespan.
With SottoPelle, replacement hormones are delivered through a unique, minimally invasive process.
After proper evaluation with the appropriate lab work and being able to determine the exact dosage that is necessary for that particular individual, we then utilize a painless procedure which allows us to place the pellets underneath the skin directly into the fatty tissue. For maintaining consistent hormone levels, we usually ask people to return it about every 4 to 6 months. And that seems to be a very stable interval of time to help maintain consistent, continual levels.
SottoPelle was developed by Dr. Tutera, widely recognized as the pioneer in the field of bioidentical hormone therapy. Dr. Tutera has helped thousands of patients reclaim their youth and vigor through bioidentical hormone replacement therapy.
A lot of people come into midlife in their 50s, 60s, and decide that they're just going to kind of do the rubber-soled shoes and the elastic waistbands. And that's where I was. And I decided that I needed more out of life and that I was only halfway done with my life. I wasn't 3/4 of the way done. So when I went on SottoPelle, my energy increased, my headaches disappeared almost immediately. It's pretty easy for me to recommend SottoPelle to other prospective patients because it's changed my life so much. Between the night sweats and the change in the attitude and the outlook on life, I know of some friends of mine who I've sent here that they can't thank me enough for making the recommendation to change their life.
I was depressed, I was drained, no energy. I was running a $400 million company. I came in to see Dr. Tutera. He put me on the pellet shots, and from that time on, I've never been off of them. I highly recommend it to anybody. It's the best thing that ever happened to me in my life. I look younger, I feel younger, and I'm 68 years old today, and I feel like I was when I was 50 years old. I just can't believe why more men don't do this. I mean, I've got more energy than I ever had in my life. My sex life is better than it's ever been, and I think it's all due to this.
The first, I think it was maybe 2 weeks after my initial treatment, I felt like a new person. It was totally different. And it's so much easier. You don't have to deal with the creams. It's just simple. And I'm so happy. It's changed my life. I tell Dr. Tutera all the time. He's literally changed my life. Women are living a lot longer these days. And the hormones aren't there for us. So we need to replace them.
Hormone replacement therapy isn't something that guys usually think about being part of their life and their health. And I will tell you that I clearly recommend this to guys just due to the fact that I've seen the results and I can be passionate about it because I believe in it. It's happened to me, it's ongoing with me, and it's changed my life, obviously for the better.
SottoPelle, hormonal balance well-being.
Our great hope is that we are able to spread the usage of this therapy throughout the nation and hopefully eventually maybe even go globally with this particular therapy because it is so helpful for patients and it has such success associated with it.
For more information about SottoPelle hormones, visit SottoPelletherapy.com.